Hi, my name is Gianna Creighton, and I did the 2009 H1N1 Pandemic. Step 1. Gather background information. There was an outbreak of the H1N1 virus containing influenza A in Mexico, which quickly spread to at least three continents, which led to mass infection. By the end of July 2009, more than 40,000 laboratory confirmed infections had been reported, representing only a fraction of total cases, which was likely an understatement. It is estimated that 1.8 million to 5.7 million cases occurred. Also known as the swine flu, because the H1N1 contained two strands of a swine virus previously found in pigs. The highest rate of infection was in Australia in kids under the age of 5. Step 2. Analyze the current situation. The strength would be medical advancements of this time allowed for a somewhat accurate way to identify those who have and have not been infected by the H1N1 virus. Weakness. Persons with influenza may not be included in reported counts for a variety of reasons, including the following. Not all ill persons seek medical care and have a specimen collected. Not all specimens are sent to a public health laboratory for confirmatory testing, and not all specimens will give positive results because of the timing of collection or the quality of the specimen. Opportunity. It is a chance for the medical field to use laboratory equipment and other facilities to make a new vaccine in order to prevent those who aren't infected. Threat. This virus is easily spread through intra and intercontinental transportation methods across sea, land, and most importantly, air travel. This case needs to solve the issue of the rapid spread of the virus from person to person. The World Health Organization initially relied on a plan to implement containment first, the use of assumed to be effective antivirals, and the rapid development of a vaccine. To the right, you can see the symptoms of the swine flu. Step 3. Prioritize core issues. Core issues during the outbreak included poor awareness of pandemic plans, patient and family aggression, chaotic information flow to themselves and the public, heightened stress related to increased workloads and lower levels of staffing due to illness, family care duties, and redeployment of staff to flu clinics. The root cause of all of this is that the disease is easily spread human to human and there is/was no vaccine. To the right, you can see places to wash your hands. Step 4. Analyze alternatives. The case solution to this pandemic was to limit exposure to those infected. Key health belief model messages to include are perceived susceptibility, conveying the huge threat to those who are most likely to contract the disease. Perceived benefit of quarantining those already infected in order to stop further spread. And cues to action are the growing numbers of cases that kept popping up in different countries like Mexico and Australia. 2 alternative solutions would be to increase influenza research, to make multi-year vaccines, and to enhance education and preparation for healthcare workers. Step 5. Provide recommendations. My first recommendation would be to identify and treat infection in people with moderate to severe disease and those with certain risk factors. My second recommendation would be to control outbreaks in institutions and monitor hospitalizations. To the right, you can see the symptoms of the swine flu and how to prevent it. Step 6. Establish action plan. Step 1. Require people with flu and H1N1 symptoms to get checked for the virus through clinics, primary care, or some other type of medical resource, which should take about 2 months. Step 2. Quarantine those who are infected and have medical sources directed to treating those individuals. Quarantine may last up to 3 months. Step 3. Close off all types of public transportation to highly infectious areas. Might have to quarantine an entire city. 2 weeks. Step 4. Provide vaccines to those who have not yet been vaccinated, especially young children. Step 4. My opinion. Obviously, the 2009 pandemic claimed a large amount of lives, many of them being young children. I think this case of H1N1 could have been dealt better if public health officials acted faster when the first cases started popping up in countries like Mexico and Australia. However, I do think the public health and medical experts acted in a swift way once the pandemic level was raised to a 6. This was also a difficult situation to contain because it was so easily contracted, so different approaches need to be taken. Thank you.